It's Divas That Care Radio. Stories, strategies, and ideas to inspire positive change. Welcome to Divas That Care, a network of women committed to making our world a better place for everyone. This is a global movement for women, by women, engaged in a collaborative effort to create a better world for future generations. To find out more about the movement, visit divasthatcare.com after the show. Right now, though, stay tuned for another jolt of inspiration.
Welcome, my friends, to the Divas That Care Network. And if you are like me and you have looked for holistic or natural or more safe or progressive health care for your pets, join me for today's episode of Words That Work. And I'm your host, Naomi McDonald, an animal communicator, author, and teacher dedicated to telling true stories that change lives. And my fabulous guest today, I'm sure, has many stories about the lives that he's changed and saved. And so I'd like to introduce holistic veterinarian Brad Roach. Hi, Brad, and welcome.
Hi. Thank you for having me on. What an honor. We've worked together for decades, it seems. And,
we have.
Yeah.
We have.
Yeah.
And in just a moment, I would like for you to cover the modalities that you've gone through. I'm reading your bio here, and I'm so impressed about during this time how much you've learned. And I remember the first. Go ahead.
Yeah, I love their theme about words that work, because that's kind of what we do with treatments that work. In fact, it's one of our core principles, to seek out those treatments that work and not go down the same path if it's not working, which, sometimes we run into that with holistic medicine, but it's a really big problem with conventional, because they're, like they say, if all you have is a hammer, everything looks like a nail, right? So they can. I had a lady come in the other day that had a lot of GI trouble with her dog, and they're just diagnosing with IBS, IBD, all these diagnoses, and they're really not diagnoses at all. They're just descriptions of symptoms that they want to put them on steroids for. And so it's like, that's not what that dog needs. He needs, microbiome therapy. He needs acupuncture and herbs to help heal up the gut. And so it's a crazy cycle that we get into in conventional medicine. Don't get me wrong. It's a really good marriage of conventional and holistic, because now we get the diagnostic work done that we should get done to uncover what's happening. And some of those animals are going to need surgery. Some of those animals are going to need some conventional medicine. But, if we use holistic medicine smart, we can cover the side effects that conventional medicine can cause with some of our holistic treatments. Of course, like putting animals on probiotics when they're on an antibiotic. And so there's so many ways to use this. And we're so excited that we just keep getting more and more tools. And sometimes I feel like a jack of all trades. Sometimes we've got so many things to offer.
Yes.
It can be a little bit confusing, but it's so interesting. I've been doing this 33 years now, and I just want to keep on doing it. I think, and it's because of the holistic and the freedom that we have as veterinarians to not have our practices limited to what insurance companies would pay. So, you say, well, I want to go to a doctor that does what you do. And I said, well, good luck with that, because they're all shackled by insurance. They won't even get paid for most of the stuff I do. And so, and we try to, send people in the right directions when they find out, this is a cool thing. They find out that holistic medicine works because there's no placebo in pets. They either get well or they don't get well. If they don't, we go to the next thing. And so I just love it because animals are so accepting, and they're such a mirror to what you can do with them with the natural substances, and they're it's just really neat. And so you can tell and get excited. Do you have any particular things on that bio that stood out that you'd like for me to clarify a little bit?
Well, part of the reason that I wanted to have you on my show is during my practice as an animal communicator, people quite often are at their wits' end because they don't know where to go when their pet is not a candidate for chemo or surgery and heartworms. And there's so many things that they will ask me about. And of course, I refer them holistically as much as I can. And then in my book, They Sing to Our Souls, I talk about alternative health cares in there. And I get messages quite often from people, I wish I would have known that. Could I have saved my pet if I would have known that? So that's why I'm so excited to have you with me today, is because it's time for more of us to learn and know that. So why don't you just start with some of the therapies that you do in different cases, and let's go from there.
So you brought up the term, the cancer. Of course, we're going to start this, I guess, at the tail end of things, when really the right way to start that is at the front end of the animal's life, and feeding it, species appropriate diets. I think one of the biggest problems we have right now is dog food, kibbled dog food. And so, it's really not the time to tell somebody where your dog has cancer because of the food you've been feeding it for the last 12 years. That's not the time to have that discussion. But the reality of it is 70% of our crops now are being sprayed with Roundup for harvesting reasons, not to control weeds in the in the alleys or whatever. It's just to harvest those plants. They spray Roundup on it at the end of the season. So you get a nice fresh Roundup spray on your food before you get it. And the AVMA has said that the statistics on cancer in dogs is if they live to be 10, they're going to have 50-50 chance of having cancer. And back when you and I met, I think it was in the 90s, we were doing cancer cases maybe once or twice a week. Now we do them once or twice a day. And that's some serious cancers that, malignant cancers. And so if they have a 50-50 chance of getting cancer after they're 10, there's a lot of people that aren't going to want to do, $5,000 and $10,000 chemotherapies. Now, I'm glad that they have those available for those that can afford it. My mom and my wife's mom are both going through some chemo right now, and it's looking pretty good. We don't know about the long term, but so I'm not trying to say that that kind of medicine is bad, but just not everybody wants to go down that route. And so we are really big on herbs and acupuncture, and there's some herbs that are specifically used for cancer. One is called stasis breaker, that a lot of oncologists that are dually trained in Chinese medicine and conventional oncology will use that herb. And there are specific points in the acupuncture meridians that help with stagnation. That's also meant, to get energy moving and to help with cancer. We use homeopathic medicine. We use high dose vitamin injections, and then we also have a machine that you're familiar with that delivers pulse electromagnetic frequencies called the SonoWave, and that machine is pretty unique. And it actually it works in three ways. It does first, it does like the pulse electromagnetic frequency, then it has radio frequency, and it has hyperthermia. And all three of those things are really important for setting that cancer back on its tail, because the problem with cancer is that it's hiding itself. The surveillance mechanisms are not working with cancer, so your body can't see it. And so when we put an injection of iron into that tumor, and then we put this machine on it that vibrates it at 484 megahertz, so with magnetic frequency, it starts to break up the outer layer of that tumor, and the body can now see it and start to work on it. And sometimes we follow that with a surgery, like if we found the tumor gets kind of soft, and then we can get it removed with that, and that way the margins are not quite as dangerous. The margins are easier to get, and the skin is easier to close. Now we have other modalities that will also work. The problem with that machine is it takes a lot of in clinic time, and it's not a machine that's even available for purchase. It's got a research license on it, so it's a little bit out of a lot of practitioners' hands. But there are about 15 or 20 of those machines that I know of in the U.S. And so there's that, and then we also have a product called neoplazine, which is bloodroot. And the Indians used to use this on tumors, and some people that I know of are familiar with having done that at a chiropractor's office or other naturopath, and they can cause it's a black salve. Some people know it as, and you just put that on the tumor and it can fall. It can actually literally just disintegrate and melt out of there, and as a little plug. And so that becomes very handy in places like an eye or an ear. You know, I've had animals come to me, and the vet wanted to take the whole ear off because it had a tiny little mast cell tumor in the middle of the ear flap. And so, you know, we just treated that with neoplazine with a little bit of sedation. The dog, a week later, the tumor fell out and hasn't come back. And so we love cases like that have been to universities and other places, and they just say, it's going to come back. We're not going to do another surgery on your cat's foot or whatever. And we've taken cases like that hundreds of times and just been able to cause those tumors to come out of there. And then we start talking about, well, what are you going to do now to keep the cancer process at bay? What kind of nutritional things are you going to put in? You know, we talk, at length. We have a whole cancer consult that we talk about. If people are interested, they could call the office, and we can spend a good hour with people just talking about the different therapies and different modalities and nutritional therapies and things like that for cancer. And so, and one of those treatments is always reduce the carcinogens they're currently taking in. So they have to eat better. We put them on species appropriate diets, which we try to get started earlier in their life if possible. The Roundup that's being sprayed on the food is just part of the issue. The other issue is they've got way too many carbohydrates. I went and did a review on an ingredient list the other day that had just a little bit of chicken on its first ingredient, and then it had potatoes and sweet potatoes and peas, pea hulls and pea protein. And so they had what we call split ingredients, and that's a trick of the industry to not have to make the pea component jump up in the ingredient list by weight, so they can split it out like that, and you can have a real highly glycemic vegetable that's goes to sugar quickly. And so an animal can't possibly heal when it's got insulin constantly in their system, and so they get fed 2-3 times a day dry food that has all these carbohydrates in there. They're getting an insulin spike every time. They're never you could take a 70-pound pit bull that needs to weigh 50 pounds and feed it down to half a cup of food, and you still wouldn't be able to lose weight because of the carbohydrate load. And so people are really frustrated because they know their dog's too big, but their veterinarian just puts them on a guilt trip and saying your dog's too fat, without giving them any tools really to help them lose that weight. And so yeah, what we do is really cool. And so we can do hormone therapies to try to help prevent some of that. We do high dose vitamin C injections. We've done we can measure vitamin D levels and find out if they're deficient on vitamin D. And sometimes these cancers and other GI diseases can go back to microbiome questions. So if your microbiome is out of balance, or you have a overgrowth of bad bacteria like Clostridium or E. coli, those bacteria and everything are going to keep that gut totally unbalanced. And sometimes there's a lot of histamine that gets produced with that condition, and it causes skin itching. Sometimes that'll have that gut brain, kind of heard about that gut brain interaction where they can actually have seizures. And we've been able to give dogs fecal transplants rectally to help with seizures and itching. And it seems like totally unrelated, but it's totally not unrelated. This beautiful relationship between our bacteria and our bodies should work better, but this diet, this highly processed thing that we're into, just keeps those bad bacteria churning along, and the good bacteria never have a chance. And so when we get them all straightened out with food and with the other dietary recommendations, and it can be a really beautiful thing to see them heal and not need steroids for the continuum of their life.
Right. What foods do you recommend? What are some of the foods that you recommend?
Oh, well, we usually use beef as our primary one because we recommend that we not cook it very much. There's a lot of enzymes and natural substances in beef that are and other meats that are good for dogs that people don't know about. My beef, one of my beefs with the nutritional industry is they think they know everything about it just by breaking it down by amino acids. And that's such a conceited viewpoint to say that we know about nutrition because we've got the right kind of amino acids from this corn. Well, a cat is an obligate carnivore. There's so many things in meat that they need that doesn't even have anything to do with the vegetable. And so that's a little bit frustrating. So we get a lot of our food from local stores. We get Texas tripe is one that we order. We recommend a lot of people order from Texas tripe. And I usually like it mixed with some kind of organ meat, like liver and kidneys. And then for the older animals, if you can find one with heart meat in it, it's even better. Because, I learned from an older mentor of mine, Dr. McLaren. He was a really cool guy from Australia. Anyways, he always talked about the older guys in medicine, not including himself, but the older guys than him used to recommend that we feed the organ that you're deficient on. And so if you had liver trouble, you eat liver. If you had heart problems, you need to eat heart. So we kind of go by that. And we have actually vitamin companies have recognized that association for decades, and like Standard Process has a whole line of vitamins that cater to that kind of medication, where they're using the glandulars is what they call it.
Yes.
And so yeah, it has a pretty cool thing. I mean, we can just depends on the dog's condition and what they will like to eat. Interestingly, I bought a program recently. I haven't quite mastered it yet, but we're working on it. It's called the Animal Diet Formulator, where we can take what the animal likes to eat, what the owner has on hand, and we can formulate a diet. And so I usually like to put them together raw. And if you click, it has a button where you can click cook it. And so if you click the cook button, you would be surprised how many nutrients you have to go back in and rebalance. So it just shows me, that there's a lot of stuff in that cooking process that doesn't make it through. And so it can be, it's a kind of a case by case basis and based on what the dog likes and what the owner can stand. And I've got many vegan/vegetarian owners that will go ahead and say, okay, I've got my dog on this meat. I can barely stand it, but I know he needs it. And so,
yes.
Because they're not evolved vegetarians, they're carnivores, and they should be able to eat meat. And so, and most people have common sense enough to know to wash their hands and to take care of kitchen utensils properly when they're using raw meat. But what most people don't know is that even the raw food, or the cooked foods, the dry foods, can get recalled very frequently for salmonella, E. coli, and other processing errors. And so you have to be also be aware that can be there. And so there's a lot of hidden dangers in just opening the bag and pouring out the dry food. Plus, like in a Chinese view of things, they feel like these proteins are like either cooling on one side or heating on the other.
Yes.
They have natural properties, and those make the dog either hotter or cooler. And so every dog is going to be different. We have a Chihuahua that'd rather be up under the covers, and we have another dog that will not lay on the carpet. He has to lay on tile floor just to stay cool enough. And the dietary recommendations for those two kinds of different dogs are different. And so it's really interesting. And it's all about case by case individualized therapy. If you come to our clinic, you're not going to get 12 minutes and you're out of there type of thing. It's really pretty involved, and we try to zero in on what's doable, what's affordable, and what the patient will tolerate. And so, and that goes for even just routine things like vaccines. Not every animal, and it makes it hard to practice as a veterinarian because you can't just tell the technicians to go into the room and do whatever we normally do, because every dog is going to be different. They're not going to get a full set of vaccines if they're under 5 pounds. They're going to get minimized doses. They're going to get lengthened intervals between the doses. And then when we get all done with that, we're going to measure the antibody titers and make sure they're protected for parvo, that whole process actually worked. And so then we do
Right.
that on a yearly basis for our holistic clients, where you don't have to go in and over vaccinate them over and over and over. And so, yeah, it's a whole different ball game. But I really feel like veterinarians are ready for the change. And we just hired a veterinarian that is just like, she's worked for 18 years in the conventional field, and she just ran out of tools. And I heard you talk at a meeting a couple of years ago, and I wanted to join on and see what you have to teach me and offer people. So that's pretty exciting, when you have other professionals that are reaching out and referring people because they know that there's really something to it.
There is. That's wonderful. Another thing that comes up quite often is joint care and mobility care.
Oh, yeah.
And I know there's Adequan and there's Cosequin and there's different things, but that are very, very helpful. But a lot of your standard anti-inflammatories and pain relievers are detrimental in a way. So if someone wanted a safer, more holistic approach to mobility, what would you recommend?
We actually have a consult called Mobility Consult. It's funny you mentioned that, but we haven't talked about this yet. But mobility consults oftentimes will include, by the way, one of my favorite challenges when I say game on is when somebody says, my dog's on Remedil, I don't know what to do. And they don't like it.
Yes. No.
And so for me, that's like an internal challenge. It's like, I'm getting this dog off carprofen. And
yes.
So they come in and we weigh them on a scale that measures all different quadrants of how much weight they're putting on each foot. And sometimes they just sit down and it doesn't work. But, most of the time we can actually get a pretty good measurement, and we can tell in the future, how we're making progress on that. And then we also have a heat sensing camera that we can take pictures of the dog from different angles and see what joints are hotter than the others. So sometimes we come in and we don't know where this dog is sore, but he's just sore in the back rear somewhere. And so that helps us get closer. But over the years, with palpation and honing our skills, we can get down to where we can usually locate, okay, now this dog has 3 areas of the back, his left hip and his right shoulder are hurting him, which a lot of times dogs work on a diagonal, just like horses. If this shoulder's hurting, then the left hip will also kind of absorb some of that. So the mobility consult just describes the chart we go through describes, something easy like acupuncture, and also an alteration of that would be electroacupuncture, which is better for back cases, in my opinion. And then we can pivot up. Yeah, and then we can pivot up to homeopathic injections. Like there's this stuff we get from Europe. Unfortunately, the United States ran this company out of the country, but they just homeopathically have these homeopathic ingredients for arthritis. One of them is called Zeal, one's called Trameal. A lot of chiropractors know about these and they still use them, but it's harder to get. But we inject these into the acupuncture points that we find that are tender, and also like a master point. Like if the hips are hurting, we'll inject it on 3 points for the hip and then a master point for the lower back and hips. And then we put it in an endorphin point. And we're talking about just like 1/4 of a mil, just really small injections. And we call that biological therapy. And it really helps keep a lot of animals going, because you get the acupuncture stimulation from the pressure that stuff puts on it, but you also get the effect from the homeopathic ingredient. And it's a lifesaver for a lot of dogs. Plus, it's not as expensive as some of the other therapies that we have that are more, I would say, more invasive, which include prolotherapy. Now, prolotherapy stands for proliferation. In proliferation, what we do is we're injecting the ligaments and their attachments, and we're trying to get that ligament to actually proliferate. And it works because we use dextrose, and the body responds to sugar in between cell spaces like it's a foreign body, and it's got to take it out. So the macrophages, the little Pac-Man of the body, come in and they chew that up, and then they send out a signal to the fibroblasts, which tell the body to come in and fix that area. So it's a really neat cascade of events that causes strengthening of ligaments, and it's the only way to medically treat it. Now, you can surgically strengthen ligaments, but to medically treat ligaments, there's really no other way to do it than prolotherapy. And then we use prolozone, which is prolotherapy plus ozone therapies. And the ozone is really cool because it's highly anti-inflammatory, provides oxygen to the area, and it tells the body that there's something there in that area it needs to go work on. And so I tell you, the more I use ozone, the more impressed I'm with its effectiveness on not only joint pain and stuff like that, but also cancer as an anti-infective agent, because it's antibacterial, antiviral.
Mm-hmm.
And so we use a lot of ozone therapies in the clinic, and it gets more and more usage as time goes on. And I really feel like that is one of the saving graces that we're going to have in this era of antibiotics and the superbugs and the things we're running up against, because nothing withstands ozone therapy. None of those bugs can survive. And so we can inject it, we can put it in the joints, we can put it in the blood, we can put it, in oil to apply it to the body. There's all kinds of different ways to get ozone in the body. And on the human side, they use it, intravaginally, and we use it rectally on both human and animal side. And so it's just a really neat way to get things done in the body, and that a lot of people don't know about. And then the more regenerative therapies, after that, I'll be done. The prolotherapy, we alternate that with PRP, which is platelet-rich plasma, and that's the platelets are just magical, and God made the platelets to stop bleeding, but at the same time, there's about 9 different chemicals in the platelets that attract stem cell activity. So isn't that cool? You can stop your blood and then also start the healing at the same time. And we have a centrifuge that can actually separate the platelets from the dog's blood, and we can inject it back in the joints or around the joint, and it really causes that healing response to cause more cartilage growth. So the prolozone, the ozone, will help with inflammation, and then the PRP, we alternate with that to cause more growth of the right kinds of tissues where we need them. And so those two together really make a good combination. And then the last thing that we can do, but it doesn't get done very often because of its $4,500 price tag, is stem cell therapy. But the PRP is a really inexpensive way to get stem cell-like therapy effectiveness for those dogs that need to get more mobile. People come to me all the time and they say, I've been quoted $5,000 for the right knee. And I got online and I started reading about usually the other knee goes out too within a year to 18 months. And they're right. That does happen. Some surgeons are honest with people and tell them that's going to happen, but then they're into it, for 2 knee surgeries, and when they could have prevented that whole thing with doing some prolotherapy and PRP. So,
okay.
Yeah, that's a fast blast of a lot of stuff that we do.
Yes, that is. That's a fast blast. But what I really like about it is the things that you're describing are ways that allow the body to regenerate itself, that reminds itself and the body what is whole. And it allows the healing to come from the inside instead of a Band-Aid.
Right. And usually you'll find that with conventional medicine, it works really good at first and everybody's happy with it, but it becomes the next problem. And that's just like another story in life.
Yes.
You have room for 2 cars in the garage, so you build a third part of your driveway, and then that driveway causes water to drain differently. And that's just a little example of life. One problem, one solution becomes the next problem. And so when we do medicine this way, that usually doesn't happen. In fact, you get side benefits. So when we treat with nutritional therapies and herbal therapies, we may be strengthening the liver at the same time as treating the cancer. And the liver is in charge of cancer surveillance, a big part of it anyways. And so then you get your cancer surveillance that goes up. And I didn't mention earlier, but sometimes it's really nice to know, especially if we get into cancer therapy that's going to be kind of protracted, or maybe like neoplasia that might cause a little bit of pain. It's always good to know what the animal thinks. And that's where we rely on you.
Yeah.
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 And so,
I love it.
yeah,
Yes.
so we've sent numerous people on a little mission. We can't use that as a diagnostic anymore, as we found out, but
Uh-huh. Uh-huh.
it sure is nice. It's valuable for the owner to know this about these issues of their pets and what their desires are. And
Yes.
some more
Yes.
often than not, it seems like the dog's more worried about the person than the person is about the dog. And
For
so,
sure.
yeah. And so
For sure.
I just love what you do, and I wish I could do that.
Oh, well, thank you. I'm sure you can.
Yeah.
But what we've covered this evening has been just wonderful, because what that tells people is there is more hope on the other side for almost any Mandalay or disease or something that is going on with their pets. And that is, it makes your heart happy.
Mhm.
And to know. And so I wrote it down for those that live in other towns and other countries, because they're going, oh, that was a lot. I don't necessarily remember
Yeah.
all of that, or which way do I go? But there is the ahvma.org, correct?
Yep.
And
And you can get on that website and push on the Find a Vet button, and it'll tell you all the different things that they do: the acupuncture, the prolotherapy, the ozone. It'll say what they do. So if you're interested in something in particular, you can usually find a vet fairly close by looking at that thing there. We do some telephone consults, but unfortunately, in the state of Oklahoma, as it stands now, I have to actually put my hands on the pet before I can prescribe. And to create that veterinary client-patient relationship, we call it a VCPR. So, I can make some generic recommendations based on a phone call, but a lot of times that involves, like, let's talk about this now, and then we'll plan a trip over here for the future, and then we can decide how we're going to proceed from there. So we have a lot of out-of-town people that have come up from long distances. We also do surgeries like ovarian sparing spays, and we do the male vasectomies, and so there's some other really cool ways to keep the hormones. And that's where a lot of people will say, okay, I don't mind driving up from Texas or coming in from another state, because that's a very short procedure that can actually be an investment in their future health. So, yeah.
I would have never thought about that, but how comforting to know that there is another way to go, because so often my clients they're desperate, and they've been searching and they don't know where to go. So this information has been just absolutely wonderful, and what you do and where you've come, because I remember being in your office and seeing some homeopathic products and going, oh, and you're going, well, I think I might dabble in that some. So I think you dibbled and you dabbled and you
Yeah, we
learned and you
did,
went
and
on.
we got pretty good at it. And we were teaching it on a bigger level in Colorado, and I was one of the instructors. But then when they decided that the company didn't want to be in the U.S. anymore, we kind of halted our training. But it still lives on in a bunch of us who are carrying it forward. And it's not like I'm bragging that we've done great things. I'm just walking on the backs of those who have sacrificed before me. And when it was really hard to do and really against the grain, now people have such a distrust in pharmacy that it's not hard at all to, talk to somebody about using alternative medicine. Even in the Podunk, Oklahoma, small town stuff, they're still hungry for it, and they know that the dangers of conventional medicine are there. So.
Right. And so I want to thank you so much for the time and the effort and the dedication. And thanks for definitely being here with us this evening. And I also want to thank all the veterinarians everywhere, because what you do it takes knowledge, It takes time. It takes a lot of dedication in your life. And it also wears on your heart. There's a lot of heart involvement in what you do, because you wouldn't be doing it if you weren't compassionate and loving and caring.
Yeah, well, we appreciate that. And I do have a sympathy for other vets who are kind of in a bind and don't feel like they have enough tools. And it can be a frustrating spot to be in, even when you do have a lot of tools. And it's and one thing I would encourage people to do also, just have a lot of patience with your vet right now, because of the COVID thing really kind of threw a loop for veterinarians. The adoptions were extremely high. The the human animal bond was more, palpable at that time, because they're working at home, and they knew their dog had bad breath and they couldn't stand it. So they went and got their teeth cleaned. Anyways, the whole thing has been such a busy time that now it takes sometimes 2 and 3 weeks to get in. And some people get really, really upset by that, but we just have to realize these are cycles in business. It will not stay that way forever. And just be a little bit patient with them, whether they're conventional or whether they're trying to do something holistic or not.
Yes.
And I don't mind talking with somebody's veterinarian too, if they've got some other issues they want them to talk. I don't mind talking to their veterinarian and working with them on treatments too.
Yeah, wonderful. Wonderful. Okay. Well, and I want to thank everyone that has joined us this evening. And I'm so happy and excited that you were here and that you're listening. And each and every person out there that cares for their pets, loves their pets, because like me, so often they'll be tenacious about solving an issue or a problem with their pet, even more so than they will for themselves. And so each and every person out there that loves their pet, I thank you so much for being here and listening. And thank you, Divas That Care Network, for offering this beautiful platform for us to share all this wonderful knowledge. And until next time, bye-bye.
See ya.
Okay. I think that went pretty good.
Yeah. Yeah.
So I don't know how long it was. I can't tell.
It was probably over 20, but covered a lot of stuff.
That was a lot of stuff, and that was really good. And I think I would like to get more into the vibrational healing too of the machine that does that, because now that can be done long distance, right?
Oh, you're talking about the AO scanner. That can be done, and we know people that do it. We sort of just the integration of that is a little more complex than what I thought. In other words, Carrie was scanning a friend of hers, and it tested positive for syphilis, right? So, and now they're all worried about syphilis going down the track of, how do we get this and all that, when really it was just a cellular memory from a past.
Yes.
From the past.
Yes.
And it gets really entangled in that. And I didn't really want to use that in the practice right now until that gets.
Okay. The Avatar did that, remember?
Yeah.
The Avatar machine would do that.
Right. And so I kind of lost my Zoom, my
sure.
My enthusiasm for that. But come on. But the sauna wave is definitely has to be done like in person, because of how that's arranged. It's a suitcase with a little pad with a little wire hooked to it, and so that has to be done in person. And unfortunately, it really needs to be done twice a week, and so it's going to inhibit a lot of people from doing it. But yeah.
Okay. Well, wonderful. Thank you very much.
Well, you're welcome. I like what you're doing. It's kind of cool. And I know that you used to teach people how to do that animal communication, and I think we're to a point where we're pretty open to doing that. At least Carrie is, and
Yeah.
I don't know if you can put together
Well,
maybe
and if you want, I've done a couple Zoom ones, and the people that attended were happy, but it's like I do better on a weekend. And I have people down in your area and in the city that want to attend.
Yeah.
Becky, much more.
Oh yeah, I know her.
Yes, she's been after me to do that for a long time.
Yeah.
And so let's make a time, and I'll just take a weekend whenever you would have a weekend, and we'll do it. I have a friend that I teach at her house in Oklahoma City, or we'll find someplace to teach it.
Yeah,
and
we could teach it right in the clinic right there if you wanted to, and we could invite our clients. I bet we'd have 15, 20 people that could come that might be interested in that. And so
perfect. Let's do it.
Since we don't work on Saturdays now anymore, and we're taking the second 2 Fridays of the week of the month, we take off half day. So we have Friday, Saturday, Sunday, that if you wanted to do a workshop that was a couple days long, or an evening and a day, we could do that, and you could stay at our place or whatever you like to do.
Okay, that sounds great. I would love to, because it is better in person. So
yeah,
I'll just come and do it at the clinic. And
yeah, and we could do like session 1, and then 6 weeks later or 4 weeks later do it again.
Yep. Right.
A lot of times in winter times, if we don't get too close to Christmas, is a really good time for that.
Okay. I'm going to Egypt in October, so we might try mid-November.
Nice. Going to Egypt, huh?
Oh, I'm excited.
Oh, I bet.
Yeah. Very much a spiritual pilgrimage to Egypt.
Yeah.
Yeah. All righty. I am going to let you go. Thank you very much.
Yes.
And we'll figure it out, and I'm sure we'll do it again.
Yeah, that sounds good.
Okay.
All right.
Bye.
Bye-bye.
Thanks for listening. This show was brought to you by Divas That Care. Connect with us on Facebook, on Instagram, and of course on divasthatcare.com, where you can subscribe to our newsletter so you don't miss a thing.